You know that feeling, right? You're sitting on the exam table in that paper gown and you're just wondering, what is really going on here? Well, today we're going to pull back the curtain on the medical checkup. We're going to demystify the whole thing, from the second you walk in the door to the final notes your doctor writes in your chart. Seriously, have you ever caught yourself wondering what's going through your provider's mind when they're listening to your chest or tapping on your back? What kind of clues are they looking for? Well, think of this as your official insider's guide. So here's how we're going to break it all down. First, we'll talk about setting the stage for a good exam. Then we'll get into the art of the interview. That's where your story becomes the main event. After that, we'll cover the 4 core techniques of the physical exam. We'll even take a quick tour of the body to see how they work, and then wrap it all up by decoding the doctor's notes. Let's do this. Okay, let's kick things off with part 1, setting the stage. And you might think it's just an exam room, but believe me, it is so much more than that. You see, before a single instrument even gets picked up, a foundation of trust has to be built. It all starts with the basics, like making sure you have privacy and the room is a comfortable temperature. But it's also about these small, really crucial details, like the provider sitting at eye level with you, getting rid of any barriers like a big desk between you. It's all designed to create this open channel of communication where the focus is 100% on you, not on a notepad. And that brings us to part 2, the art of the interview. Because honestly, the most powerful diagnostic tool any provider has isn't some fancy piece of equipment. It's the story that you tell. This is really where we see the 2 kinds of information that get collected. So on one side, you've got what's called subjective data. That's your story, everything you tell them about your symptoms, how you're feeling, your concerns. Then on the other side, you've got objective data. That's what the provider can see, feel, and hear during the exam itself. But here's the key. Your story, the subjective part, always comes first. And that story officially kicks off right here. The very first piece of the whole medical puzzle is something called the chief complaint, and it's actually documented as a direct quote from you. You can think of it like the headline for your visit. It sets the direction for everything that's going to follow. So starting with that chief complaint, the provider starts building out a complete picture. They'll dig into the details of what's happening right now, sure, but they'll also zoom out to look at your past medical history, your family's health, and even social stuff, like what you do for work or what your lifestyle is like. Every single piece is another clue in this big diagnostic puzzle. Okay, so once the story has been told, we move into the hands-on part of the visit. This is part 3, the 4 core techniques, and this is where the provider's own senses really get to work. Now, this is their basic toolkit, and it's actually pretty simple when you break it down. It starts with inspection, which is literally just observing with their eyes. Next up is palpation, and that's just using touch to feel for things like temperature, texture, or if something is tender. Then you've got percussion. That's the tapping you might feel on your back or your stomach. It's kind of like tapping a watermelon to figure out if what's underneath is hollow and full of air, or if it's filled with fluid, or if it's solid. And finally, there's auscultation, and that's listening to the sounds your body makes using a stethoscope. So let's actually see how these techniques work in the real world. Welcome to part 4, a tour of the body, where we see it all put into practice. And our first stop is a classic part of almost any checkup, listening to the lungs. So when a provider puts that stethoscope on your back, they're listening for nice, clear breath sounds. But they're also listening for what are called adventitious sounds, which is just a fancy way of saying sounds that shouldn't be there. Things like wheezes, those high-pitched musical sounds you might hear with asthma, or crackles, which are these little popping noises that can point to fluid, or even raunchy, which are these low-pitched, almost snore-like sounds. Each sound tells its own story. All right, from the lungs, let's move on over to the body's engine. Next up, the heart. Now for the heart, that classic lub-dub you always hear about, those are the normal S1 and S2 sounds of your heart valves snapping shut. A provider is listening to make sure that rhythm is nice and steady, but they're also listening for any extra sounds, like a murmur, which is often described as this blowing or swooshing noise that means blood isn't flowing smoothly. Other sounds, like rubs or gallops, can also be clues to very specific conditions. And for the final stop on our quick tour, we're heading to the abdomen, which actually comes with its own special rule. So here's that little twist I mentioned. For pretty much the whole body, the order is inspect, palpate, percuss, auscultate. But for the abdomen, the order changes. They listen with the stethoscope, auscultation, before they start tapping or pressing. And why do they do that?
Well, it's to make sure they hear your natural, undisturbed bowel sounds before all that poking and prodding potentially stirs things up and changes what they hear. Pretty smart, right?
Okay, the history has been taken, the exam is all done, so now what? How does all of this information get turned into an actual plan? Well, that brings us to our final section, Part 5, Decoding the Doctor's Notes. It all gets organized into something called a SOAP note. Think of it as the blueprint for your care, and it's a really logical system. S is for subjective. That's your story. O is for objective. Those are the findings from the physical exam. A is for the assessment, which is basically the diagnosis, or what the provider thinks is going on. And finally, P is for the plan, the actual next steps, like tests, new treatments, or when to follow up. And really, that's the entire point of the visit. The whole process, from that first hello all the way to that final note in the chart, is a structured way to take your personal experience and the provider's observations and turn them into a clear, concrete plan for your health.
So if there's one thing to take away from all this, it's that a checkup isn't just something that happens to you. It's a team effort. It's a conversation where you are, by far, the most important expert in the room. So the only real question left is, are you ready to tell your story?